Busulwa Juliet from the University of Massachusetts, USA. We're doing a doctorate in public health. But amid distance, because I think last time when she came here, she did not see our coordinator, our program manager, Dr. Namde Matindi. Yeah, she's here with us today. So for any advice, any changes, she's come to this infrastructure to present to us. And the rest of us are the team members that are actually making the work going in this department. There are more things they find us along the way. So I think on behalf of the team, let me do welcome you, and we are all ears for you.
Thank you. Thank you very much. Like I said, my name is Juliet Busulwa. I was here at Mengo Hospital before most of you, maybe some of you were even born. I was here in 1985 as a student nurse at that time. And from here I went to Raga Hospital. That's where I was trained as a registered nurse. In 1995. 1996 I went to the United States of America. And from there I went for my bachelor's in nursing. Then I'm on this road for my doctorate, and I'll be graduating in May. I'm glad to be here, and I'm glad that you guys are here and willing to listen to what I have to present. I have some pre-assessment knowledge that I'm going to pass these papers. Please do me a favor and fill them out, because I just want to know how much you know about the topic. And then after, I'm going to do the post-assessment. You can leave the last page because it's the training. We're going to do another one at the end of the training. It's the same questions. I just want to assess how much you know about this. There's no pass or fail. It's just be honest and let me know. Okay? Just put your names on. It's just self-explanatory. Whoever finishes is going to get a certificate. But if you don't complete, you won't get a certificate at the end. So Friday when we are done, I'll be giving out certificates for those who have completed the whole training. So there's no skipping. Are you planning on skipping? No. So before we begin, I would like to know something about you, at least your names, what you do in healthcare. So just 1 minute so that we know at least who we are. All right? Anybody can begin.
I'm a Christian, enrolled as sales provider. I'm a Sophia, progressive nurse, sales representative. I'm a Christian, registered nurse, sales representative. I'm Dora Lanzaren, graduate technician, I am grandparent, about the technologist, marketing.
Okay, nice to have you. The topic today is HIV partner counseling and referral services, and basically it's about providers incorporating counseling. When we see clients who are HIV positive, it's our job to really initiate this topic of letting the partners be notified, because most people are really scared. For the most part, we tell them that you go and tell your partner, but we don't really help them. We know it's really a big challenge to go and tell your loved one that I'm HIV positive. You don't know the consequences. You may be abandoned, you may be left, you may be abused, a lot can happen. But here, providers have to step in and help clients. And I believe we have provider assistance counseling here. Yes, but I don't know how far we go. I don't know. We have outreaches. So basically, why do we promote partner counseling? I'll be using the word partner services. Basically, is to assist people living with HIV to tell their partners about possible exposure. And it's not like we're going to force them. We really depend on them. We just try hard. We try our best to convince them to work with us so that they can notify their partners. It has to be voluntary and confidential service. And there are different types of options that we need to offer them. Not only one option that you go and tell him or her, but we need to step in and offer other options, and we're going to be discussing these options. Basically, it's a multi-stage service. You can't do it all at one time. It's good to start after diagnosing the client with HIV, and you make sure that they are given all the necessary services. They have a provider, they have a case manager. Once you take care of their immediate needs, then you can bring this topic of partner services. And then, because the goal is to identify those who are not aware that they are HIV positive, and there are so many people, even in the United States, that 25% of people who are HIV positive don't know their status. So it's really important that we let these people know so that they can get tested and then start treatment early. So basically, I will ask anyone who can read this slide for us, so that I'm not the only one talking. Anybody can volunteer to read the slide.
It is a multi-stage service that facilitates the identification of sexual and drug-using partners of HIV-infected clients, notifies these partners of past or ongoing exposure to HIV, and facilitates HIV-positive partners' entry into care.
Yeah. Seen today, and they are not willing to tell their partners, but it's our job to continue whenever we are in touch with them to bring this topic. And again, they can dispose today, but then tomorrow they get new partners. So it's not like we're going to control them, they're still going to live their lives the way they want to. So every time we meet them, it's good to bring up this topic that they have new people. Like, we all know that they're still human beings and they still have their behaviors. The only thing we can do is harm reduction. We are trying to, to bring this topic every time we're in touch with them, and that's why it's called a multi-stage service. Okay, the learning objective today is partner services, which we know is just services that is gonna let other partners know that they are exposed to HIV. And again, it's participants will be able to explain the importance of this in relation to HIV prevention, and be able to initiate a discussion of the 4 partner referral options. It's bad we have, I don't know how many counselors we have here, or case managers, or nurses, doctors, whatever. But again, the rationale is to interrupt HIV transmission and prevent complication. When we interrupt, it's because people who don't know that they're HIV positive or negative, for that matter, they just live recklessly. Most of them don't even, because they don't know what to protect or what to, they just continue spreading. So it's really important when they know their status. Our job is to get them to know their status. And especially these ones are at high risk because we know their partners are HIV positive. So we want to interrupt that transmission circle to get them. If you don't bring the topic, most likely they won't be able to act on it. But it's really important that we can, every time we cancel, every time we see them, every time we have an interaction with our clients, we need to let them know. Anybody can read the post for us, please.
goals. Offer all HIV-infected individuals with support to ensure that their partners are confidentially informed of exposure. Increase the proportion of partners who are notified of their exposure. Enhance linkage to medical care, treatment, prevention interventions to reduce transmission rates. Decrease rates of transmission by aiding in early diagnosis and treatment.
I get more people who are affected because they really don't know that the HIV positive, they are not using protection. But at least if we tell them, we're going to give them counsel, we're going to educate them more, we're going to promote condom use, and maybe we're going to break the circle of HIV. The importance, basically I've already spoken about the importance, is to let these people who are unaware of their status know so that they can get treatment, because we know the earlier people get treatment, the better for them. And again, we offer them testing. We don't just tell them that you may be exposed. This service does the testing too. As soon as you notify them, you make sure that you offer them testing, you encourage them to test. Again, we don't force them, it's voluntary. And if they do, then we link them to services. We link them to medical personnel and all the support groups that are in place. So it helps to identify those who are previously undiagnosed with HIV. It's evidence-based. It's not like something that they just decided to do. They did research on it and they found out that many people can be notified, they can know their status and get treatment if we do the partner services. The study that was done in the US, among the above 14,000 partners who were notified, 52